My name is Rochelle Yellen. I am a fourth-year medical student rotating at Kauai Delta for a street medicine rotation. So throughout medical school, I've always had a passion for helping the homeless community and the underserved. And when talking with Dr. Guzman at Kauai Delta, we wanted to put together a street medicine rotation and have students be able to rotate to do this rotation. It was really exciting when it was approved. We didn't know if it was actually going to be able to come together this quickly as I graduate in a couple of months, but once we heard that it was approved from my school in Kauai Delta, it was pretty exciting. And so by having medical students going to the streets, seeing what it's like to live here, eat here in the cold, they really realize what it's like to be homeless. So then when they are back in clinic or in the hospital, there's a little more sympathy. They can kind of relate to the patients more, and it changes their approach to medicine. So a lot of the time when we come to the street, we see a lot of different infections. We see a lot of foot infections. For example, people have diabetes as well, and they need some medication refills or just hypertension. Or a lot of people just want general information on their health because they haven't seen a primary doctor in years because they can't afford it and they don't have access to it. So by coming to the street, we're able to treat their infection, we're able to help their diabetes and any other issues they have. But ultimately, street medicine is helping anybody that doesn't have access to care. So what sets street medicine apart is instead of people coming to the doctor, they're coming to the clinic or the hospital, we're actually going to them. But just by introducing ourselves, telling them where we're from and what we're here to offer, they're usually very receptive to it. By now that we've come out here several times, they kind of know us by face, and they know that they can trust us. And we actually have some people out here that know us so well that they go throughout the encampment telling people that we're here to help and telling people that we're safe, we're not here to hurt them, we're not here to turn them in, we're just here to give them services. And they actually bring people to us, which is really nice to see. So one thing that I was most shocked about with this rotation and just working with the street medicine in general is that a lot of the people that are suffering from homelessness actually do care about their health. You would expect someone to think that they don't care about what their medical conditions are, what their health is like because they live in this kind of situation. But the fact is it's completely opposite. They really care about their health. They want to know what they have, what they can do, and what they can change. And a lot of the time when we're treating them for medical conditions at the street medicine program, a lot of it's just educating them and giving them reassurance that they are healthy and that they're going to be okay. So I was really fortunate growing up having a father who's a physician and then a mother who's a nurse. But with that, they taught me from a young age to always help those in need and treat everybody like we're family. And so my mother and I would actually go to the homeless community in Santa Cruz and cook for them about twice a month and bring them a home-cooked meal and sit with them and talk to them and eat a dinner with them and treat it like it was a family dinner. And from a young age, that's what was instilled to me, and that's what I grew up wanting to do. And going into medical school, I wanted to continue that.